it's really not friction, it's required engagement. And what we've seen is when a group has engagement already built, it's easy to require just a little bit more. When a group goes from, hey, we don't ask anything of our employees, to, boom, we want to take control of our healthcare plan, we want to start deploying some programming, some clinical strategies, there's noise. And I would say that's more of the friction camp. But required engagement, what does that look like? That looks like for an employee to have an enhanced experience, you may have to do something a little bit differently than you previously did. And I'm a frugal person. I'm all about required engagement. If I can get something for free or low cost, or someone says, hey, if you spend some amount of time, the value is there, I'm all in. But when it's something you're not used to or it's unexpected, that is where the noise can come from, or the friction comes from. And the easiest example to share here is when a group decides to go to an unbundled ecosystem, or let's just use the simplest one, they've decided to carve out their pharmacy and their PBM partner. January 1st comes around. We've been doing education. We've been trying to get people engaged. And then January 1st, New Year's Day, they go to the pharmacy to fill their drug. Well, what typically is going to happen in a new pharmacy program January 1st, whether it's timing or whether it's a new drug being filled, a formulary may have changed, the cost, the copay structure may have changed, or just simply the plan may not cover it anymore unless the employee engages with a program. So a perfect example of this, we had a client that they needed to take control of their healthcare program. Costs were out of control. And really, they decided, hey, we're going to take a little bit more of a faster approach here than normal. What can we do? But not introduce full disruption. And part of that was pulling a pharmacy lever. Some of their employees had been in the same ecosystem for 10 years. They showed up to the pharmacy first week of January. It didn't go great. We were on a call immediately, within, I think, the same day, we were helping the employee, on calls with them, understanding how to fill their drug. And there was a little bit of a disconnect from what the employee expected versus how the plan was built.
A caveat here is this employee, and like Brandon mentioned, you still need to get prior authorization before you can get your drug, before you can get a certain type of care. Same with this type of drug this employee was trying to fill. It was a specialty drug, and they needed a prior authorization to get it, to ensure that it was medically necessary for this individual. This individual was paying $325 a month for this drug prior to the new plan. They expected to walk into the pharmacy, even after consistent communication leading up to the renewal. This employee still didn't get it, and that's normal. Sometimes it takes actual use to be able to fully understand, not just communication. And so this employee goes to the pharmacy, they can't fill their drug, they need to talk to the PBM, they need to go through a process. The process takes 3 weeks. The employee is now extremely frustrated because they're almost running out of their drug from the prior year, and they want to make sure they can get it filled. So we get involved, we get engaged, and we help this member re-explain what's happening behind the scenes and why this is happening. This employee, they'll be able to get a grace fill if their prescription runs out. We'll be able to make that happen. The PBM will be able to make that happen. They won't run out of their drug. Everything will be okay. So once the PA was approved, the employee got a grace fill. The PA was approved under a certain program where now this employee, their cost went from $325 a month to $0. They were now filling their drug for $0, saving their family $4,000 a year.
And that's where the trade-off, the required engagement, short-term frustration, you could call it, and healthcare is still one of the most intimate things we have in this country. And the friction of the required engagement here, it shows the importance of how are your people engaged before you're going to deploy something. Mm-hmm. And this was an example, we were able to get through it relatively quickly, and typically these things are, you can get through them quickly. And we always educate, employers and companies transitioning. The first 30, 60, 90 days are going to be the hardest.